Now, Gurmil Maggie, lads, recent headlines like this one seems to indicate that the exuberance to bring a child's temperature down may in fact lead to over-medication on behalf of parents. Now, that's the subject, of course, of this week's Open Pharmacy, and Kathy Maher is here to chat to us about that. Hi, Kathy.
Hi, Maura.
How are you?
Great.
I suppose the first thing we should say is that any parent doesn't want to see their child sick.
No, and the thing with children is they can get very sick quite rapidly, so they can deteriorate really quickly. So you have to it's a fine line of watching them.
Yeah, and watching that, how much you give and not give another dose to try and help them get through it. OK, let's take a look at maybe a simple fever. How do we know that that's a fever? Is it just the burning up symptoms?
Well, sometimes parents obviously can touch the forehead and feel that the child is hot, but the best thing is to take an accurate temperature reading. A very young infant would have a normal temperature of about 35, 36. So if their temperature went up as far as 38, then that would indicate a higher fever.
OK, so one of these little thermometers here, now this is all you'd need to actually check their temperature. It's so much easier than back in our days. Do you remember you'd have a thermometer in your mouth for like, 10 hours? So this is just an electronic little thing, is it?
That's a little ear one. That's very effective, actually. If you go in, we would say children with temperatures need to be checked through the night. Okay. Pop it in the ear, you can check it through the night.
Right into the ear?
Right into the ear. You switch it on, it'll tell you when it's ready. It goes into the ear and it beeps with 3 seconds when the temperature's ready to go. And
as you said, you can go into if they're in the cot or whatever, you can check it through
Absolutely.
that. OK, let's talk about medications, the different types of medications. And I suppose they're grouped into ages. So the Calpol that every parents would kind of know here. What age are we looking at here?
That's paracetamol. The Calpol, the first bottle is from 2 months upwards. Okay. 2 months is post-vaccination. Sometimes children get a little temperature after they've had an injection. And the next one is the 6+. One of the problems we would see in the pharmacy is people would say, my child is a big 5, can I give the 6+?
Oh,
that's a no-no. That's always go with the dose appropriate for the child's age.
So it doesn't matter how developed the child is?
It doesn't matter.
And this is the same type of thing again,
this
an
is
oral
just
solution?
Another brand, absolutely, of paracetamol.
What do we have here?
These are paracetamol suppositories. They're very effective maybe if the child has a tummy bug and they're getting sick and can't keep an oral medicine down. They work really, really quickly to reduce the temperature.
How long does it take for these things to be effective? Obviously, oral solutions are easier than tablets to go through the system.
Well, it's not recommended a child takes a tablet because they'll choke, so they're always oral solutions. We would say if the temperature drops by a degree within an hour, that's an effective solution. If it hasn't, we would recommend moving on to another medicine. In terms of the paracetamol suppositories, they work very, very quickly within 15 minutes, and they're very quick.
So you should take the child's temperature maybe every half hour
if
the child is sick?
Yeah, once you've given him medicine and you feel that it's not coming down, check the temperature to see if it hasn't reduced.
Okay. Now, we have some people getting in touch with us here again today, some of the viewers. Karina in Galway rang. My daughter, who's 2 years old, is prone to constipation and has been since birth. Is there anything that she could give her on a regular basis? They're getting a lot of fruit and fluids into her, but it's not making any difference, really. So regular constipation, the issue there.
Yeah, this can be quite... Really, at this child, lots of fruit and fluids. We check and say what kind of fruit and fluids. So the kiwi's very, very effective at treating constipation.
Is it? And you would have heard of prunes in the past.
Prunes and orange. A kiwi a day is really effective.
So you can mash that up and it's easy to take, isn't it?
Lots of liquids. There are some medicines. There is a thing called lactulose, which will help bring fluid back into the stool and help it come out. OK,
so that's 2 years. Now, this medicines we're going to talk about next are the older child, is it?
These are here because they're paracetamol products, but there's the risk of overdosing. If parents didn't know that there's paracetamol in those and gave them with another medicine, there could be a paracetamol overdose. They're from 2 years upwards.
From 2 years upwards, so they'd be suitable for the child we spoke about there. And another thing that you said earlier on, Kathy, is that sometimes one parent could come along and give a dose of, say, Calpol or something like that, and another parent might give T-Dex.
Absolutely.
And that, you've seen this happen?
You've seen it happen. People will come in and ask about it. Not everyone realises there's paracetamol in all products. So we check get them to check the labels and check what's on them.
Is there an amount of paracetamol that's safe? And is there an amount that when you go past that threshold, and let's just say a 2-year-old child?
Absolutely. It depends on the age of the child. So we'd always say it's 2.5 mils, which is 120 milligrams, 4 to 6 hourly, no more than 4 times in 24 hours, because it can be very dangerous if you do give too much. OK. What do you have at the end there, the Proven? What's that? The next drug, these 3 are ibuprofen. So paracetamol and ibuprofen are the 2 drugs used to reduce temperature. Never aspirin in children under 16. We might have been given Disprin as children, but never aspirin anymore in children under 16.
Why is that?
So
because the
it can
blood
cause
thinning
blood
and bleeding?
Problems.
OK.
Yeah, absolutely. So the next drug, if paracetamol isn't working or their temperature is still continuing to rise, or it's too soon to give the next dose of paracetamol, you can go with something like ibuprofen.
Yeah, because that's more of an anti-inflammatory, isn't it?
It is, but it also helps to reduce the temperature.
Okay, very good. Quick question here. Can you colour your hair when you're pregnant?
Yes.
That's a great question to you. You are pregnant. Do you colour your hair and can you?
I did at the
It's
weekend.
No problem. Excellent
Yes,
work.
you can. Absolutely fine. It's no bite too.
Kathy, thanks so much. And all of Kathy's details, it's on our website, of course. Now, that's it for today. Of course, we're